Physical therapy is not leaving patients alone in a room with a bell. Hey, what's up? My name is Dr. LeBauer, and I'm a physical therapist as well as a business coach, and I help physical therapists create more money, have more time with their family and friends, and build a career that they love. And today I'm going to tell you what physical therapy is not. Physical therapy is not leaving a patient alone in a room with a bell. It just isn't. I saw a post this morning on Facebook. It got me fired up because you know why? Because when I was a massage therapist, and I'm not discounting massage therapists or personal trainers here at all, but when I was a massage therapist, people said to me, Aaron, you're the first person to touch me where I hurt. You're the first person to actually help me. And I've been to many PTs, chiropractors, acupuncturists, surgeons. I've done all the things, and you're the first person to actually touch me where I hurt. And I got into PT because I was already seeing patients like that who, as a massage therapist, using myofascial release techniques and just spending time with people, I was able to help them when the medical profession wasn't, when they were let down by the medical profession. So no wonder they have second thoughts about starting PT again, or whether they're making the right decision with their money. Well, massage, I know what I'm gonna get. I'm gonna get my body rubbed, I'm gonna get a Swedish massage, whatever. Physical therapist, someone's probably gonna stick me on a bike or put me in a room with a hot pack with a bell. Like the question this morning was, we have 13 rooms, in the last 2 rooms, we can't hear patients ring the bells, so what kind of bell or notification system do you use? And I'm just like, you're sticking patients in a room by themselves? So modalities, if you don't know this, modalities are where patients get hurt the most in physical therapy. It's not just in rehab getting their shoulder cranked back by the therapist, which I've seen. So after shoulder surgery, like this crank on your shoulder. It's not manual therapy or cervical manipulation that's injuring people. It's hot packs and ice packs. They injure the most people. There's the most claims, and we're leaving people alone in a room by themselves during that time, which is just kind of ridiculous. To me, that's not physical therapy. Physical therapy is critical decision making around a musculoskeletal problem. If you're not a physical therapist, what that means is we problem solve together around the pain or injury that you're experiencing, okay? And make a plan for you to get better and feel stronger than ever before without pain meds, injections, or surgery. As a massage therapist, I wasn't trained to do that, but I went to school for 3 years to get my doctor of physical therapy degree, probably like you did. And I didn't spend all that time and money to go earn $35, $40 an hour to count reps and leave people in rooms. Because you know what? As a business owner, I'm not gonna pay a physical therapist to do that. I'm gonna pay someone who's like, that's like in their scope. Like, I'm gonna pay an aide or a tech to do those things. I might not even pay a personal trainer to do that, because personal trainers shouldn't be counting reps. They should be motivating you and creating plans for you, like exercise plans for you. But I'll probably have we do have a exercise specialist working with us. And you know what? They're not just counting reps that someone told them to do, they're creating the programs themselves. So physical therapy is also not like a modality itself. Physical therapy is, to me, a critical decision-making process. It's an opportunity for us to sit down together with our patients and discuss what their worries and fears are. Okay, we have a unique ability to sit and spend time with our patients, even if you only have 15 to 20 minutes, because the surgeon or physician has 5. We have that opportunity to do that. So let's not waste it and put people in a room by themselves just because insurance is gonna pay for it and we have to see someone else. To me, that says we need to change our model. And that's what we're doing, is in a cash-based therapy practice, I'm not trying to figure out how do I make more money per hour with 4 people, and like how do we manipulate the system so I can get paid to see multiple people at a time. We're transparent in our pricing. We tell people up front, here's what it's gonna cost. Here's what you can expect. I don't tell people you don't need to expect to be left alone, but they should know that they shouldn't have to wait more than 5 minutes in our waiting room, if at all. And they shouldn't be left alone in a room. The only reason to leave a patient alone in a room is for them to change their clothes, or if I need to go research something real quick, or ask a question to a colleague. Maybe we need to leave our patients alone for a little bit. Instead of doing a passive modality that's dangerous, unsupervised, let's put them on an exercise bike. And we still don't have exercise bikes in our clinic, because in our clinic, We don't have people do anything in the clinic that they can do at home on their own unless they're learning it or reviewing it in the clinic. And the number one thing people say to me why they come to see us is they went somewhere else and they were just told to ride a bike or to do some exercises that they could do at home on their own or at the gym. So is that physical therapy? If you can do something at the gym, is it physical therapy? It's no wonder that people are turning to YouTube and Instagram to learn exercises, because they're going to physical therapy and they're getting basic exercises they could get anywhere, right? They don't see a difference. So why would I spend time going to the gym to do that? So physical therapy is not just exercise. Physical therapy is not just manual therapy, because as a massage therapist in North Carolina, I can do everything manually except manipulate a joint. And up until 3 or 4 years ago as a PT, I couldn't manipulate the spine without a prescription or referral. As a massage therapist, I could mobilize, I can do soft tissue, trigger point therapy. Even as a massage therapist in North Carolina, if you have training and you have a prescription, you can do internal pelvic floor treatments. Like, there's a very little distinction between that and a physical therapist, other than the physical therapist's ability to diagnose movement problems, evaluate and prescribe exercise, prescribe self-treatment, and give a prognosis. And if we're not using that capability, are we actually doing physical therapy? Treating patients is an amazing experience. Being one-on-one with a person, whether it's for 20 minutes, 15 minutes, or an hour, hour and a half, is an amazing experience and is highly valuable. But if that's the only thing that you're doing, is that physical therapy? If you want to do that, you can be a personal trainer or a massage therapist. Massage therapy school is, when I did it, was $9,000 in 10 months. Maybe it's $15,000 now. It's certainly not $150,000. But it's very difficult to make a full-time living as a massage therapist unless you're seeing 20-something patients a week. It's a lot of hard work doing that much manual therapy, and some people do it. Other people are disillusioned. But why are we so disillusioned? Because we think we're gonna get a job and we think we're gonna treat patients and we're gonna get a job that pays us and doesn't burn us out. But what's burning you out? Managing so many people an hour. What's burning you out? Not using the skills that you were trained in and being told what to do, and you're like, I'm not a tech. I went to PT school to be a doctor of physical therapy. So treat me like a doctor, right? Okay? Doctor of physical therapy doesn't take orders and implement them. A doctor of physical therapy creates the plan. If you are a doctor of physical therapy and you are just taking orders from a physician or the surgeon and implementing their plan, you're acting like a tech with a really expensive degree, okay? If you are able to make decisions with your patient on their behalf and you're willing to fight for it and stand up for it, like Tyler Shelton, who was one of our cash PT residents, before he came on board, or maybe it was after he came on board and worked with us, he told me he was reprimanded for getting a patient better in 4 visits because the prescribed plan of care from the surgeon was 8. He's like, well, the patient's better after 4 visits. And he got reprimanded and told, no, you're supposed to treat them for the full 8 visits. He's like, but the patient was better. He was making decisions like an independent practitioner, a doctor of physical therapy. He didn't fit in that model. I wasn't trained at Elon to think like that. And so of course it wasn't like, oh, I'm gonna go fit in this model. We were trained to evaluate, prescribe, exercise, treatment, hands-on treatment, not medications, and create a prognosis and a plan for our patients. Like, it's up to me. That's me, the primary care physical therapist. I'm going to do a differential diagnosis, which means I'm going to rule out cancer, a fracture, a spinal cord compression. Okay, so what is being a doctor of physical therapy? What is physical therapy? Physical therapy is a decision-making process. You are a professional. You deserve to have the ability to make independent decisions without feeling like your supervisor or referring physician is going to reprimand or punish you for not agreeing with them. Like, that's one of the things that I really hate about getting a second opinion. Like, so my dad's a cardiologist. I remember growing up, they would send someone for a second opinion. Well, people were really afraid to tell a patient they thought something different if Dr. Joe LeBauer told him it was, a different problem, another problem. Or Dr. Joe LeBauer said this, even though you sent for a second opinion, I don't like second opinions from the same practice. Like, go to a different practice. Don't tell them you saw someone else. Now you have 2 opinions, and now as a patient, you don't know what to do. Okay, you just have to find someone you trust, and sometimes maybe that means is you don't do anything right now. You figure out, like, what does your gut tell you? You go find the 3rd opinion. Because look, not all cardiologists are the same. Not all physical therapy is the same. Just because you failed cardiology doesn't mean a cardiologist can't save your life. Just because a physical therapist didn't work for you the first time doesn't mean physical therapy isn't for you. Just because you didn't like a hamburger at Wendy's doesn't mean getting a hamburger at Five Guys is something you'll never do either. Like, there's different things. Or even like, just because you don't like food doesn't mean you had a bad experience with food once. Doesn't mean you don't like food. You know, food won't nourish you. But that's the way people think about this. And so what I want you to understand is that physical therapy is not leaving people alone. Physical therapy isn't just putting people on a bike. It's creating a plan for people. It's creating a transformation for your patients and helping them understand that it's not just about the range of motion. It's not just about getting back to exercise. If they understand, or you really, it's not them. It's like if you do the motivational interviewing to bring out from patients why this is important to them, they'll pay you whatever you ask. Because if you know why getting back to exercise is important and why what exercise does for people is important and why that next thing is important, then you can sell the transformation. I'm not sure if this is getting across. So what I'd love for you to do is just comment below. Leave me a comment and let me know what was helpful for you about this. What was your insight? Do you agree with me or not? Anyways, hit the subscribe, hit the thumbs up, like, subscribe, and click the notification bell. And let me know your thoughts. What do you think physical therapy is? What is not physical therapy that you've seen other people do? I mean, I don't think an upper body ergometer for 10 minutes while the therapist goes sees another patient, I don't think that's physical therapy either. Like an upper body ergometer, like, yeah, I can exercise. Okay, do I need to do it at physical therapy? You think there's a reason why people are getting surprise bills or why people are like, oh my God, physical therapy is expensive? It's because they don't value it. Why won't they value it? It's because you're not listening to them, and you're not spending time with them, and you're not explaining why, if I'm not spending time with you, this is what you need to be doing, and you need to do it on your own. So do it on your own. Come in 15 minutes before your appointment, get on the upper body erg. I'm not gonna bill you for it, but that's your responsibility. Put the responsibility on the patient. But I would love to know your thoughts. Did I miss something? Do you think, is there something else you've seen crazy that people are doing and charging for these days? Do you disagree with me? Like I said, either way, like, subscribe, hit the notification bell, and I'll see you on the next video.